Recurrent hemarthrosis is also a cause of episodic sudden-onset severe lameness, with the tarsocrural and antebrachiocarpal and middle carpal joints being most commonly affected. There is acute distension of the joint capsule with frank blood in the joint, and synoviocentesis reveals this pure blood. Ultrasonographic evaluation is characterized by diffuse increased echogenicity typical of hemorrhage, with or without synovial proliferation. Although in some horses this is a single episode event and the lameness resolves spontaneously, more quickly if blood is drained from the joint, in other horses the problem becomes recurrent and then removal of the lining synovial membrane may be required. Occasionally, we see impingement of an axial exostosis of the second or fourth metacarpal bones on the suspensory ligament. It's not common, but in affected horses, there is usually focal pain on palpation of the suspensory ligament, with or without pain on palpation of the exostosis or the splint. Lameness is most effectively abolished by local infiltration of local anesthetic solution around the area of impingement. And specific diagnosis requires ultrasonographic identification of adhesions between the suspensory ligament and the adjacent exostosis. There is a form of exertional rhabdomyolysis which is atypical, which results in progressive hind limb stiffness with work and reduced willingness to work. And it is associated with chronic elevation of asparto-aminotransferase concentrations. This is a 13-year-old advanced event horse who won the European 3-day event championships individually the previous year. After a couple of months of light hacking work only and turnout, the horse resumed normal work, but the flat work had deteriorated in its quality, and the rider felt that with increased work intensity, the clinical signs became more obvious, and they were characterized by lack of hind limb impulsion and engagement. There were no localizing clinical signs. The horse appeared sound in hand and on the lunge, and it was only during exercise that this progressive stiffness became apparent. And we can see scintigraphically that we have these linear stripes of increased radiopharmaceutical uptake, not only in the muscles of the hindquarters, but the muscles of the crus, and also in the hypaxial muscles in the lumbar region. Some osseous cyst-like lesions or subchondral bone cysts can induce episodic, very intermittent lameness. This is a 7-year-old general purpose riding horse with a history of episodic right hind limb lameness, which we could not reproduce over 3 days of hard work. On this occasion, we decided to investigate the horse further by skeletal scintigraphy, and we can see focal intense increased radiopharmaceutical uptake in the medial condyle of the femur. And radiographically, we can see a well-defined subchondral bone cyst with a rim of increased opacity around it and a small neck communicating with the medial femorotibial joint. On a subsequent occasion, we were able to reproduce the lameness, which was abolished by intra-articular anesthesia of the medial femorotibial joint.